Hey y'all. Okay, I was going through my emails earlier. No, I'm sorry, not emails. I don't know, my files on my computer, and I came across this. And this is something that was sent to me a while back in my email. I'm not sure who sent it, but I do know that the reason that they sent it, it has to do with the asphyxia, okay, which is strangulation, or where the airways are cut off. Okay, now they sent this to me. It was in reference to findings of Kanika's autopsy, and they were saying that some of the things in here would correspond with the autopsy findings. Okay, but also now that there's speculation that she possibly could have drowned, some of this stuff right here could come into play also. So in case it's anything important, I wanted to go ahead and share it with you guys. So I'll go ahead and start reading this. It's about asphyxia. It says, learning objectives. At the end of this lecture, you should be able to define asphyxia, list a simple classification of asphyxia, describe the general autopsy findings of asphyxial death, describe any postmortem findings specific to the various types of asphyxial death, discuss the confirmation of death by drowning. Asphyxia is defined as hypoxia or anoxia that is caused when respiratory function is hampered by interference with the mechanics of breathing. When a person is subjected to asphyxia, unconsciousness generally occurs in 2 to 3 minutes, and death in 4 to 5 minutes. Death may, however, be hastened by factors such as struggling. The increased physical activity uses up available oxygen much faster. Pre-existing respiratory disease. Poor general state of health from any cause. Classification. There are several classification schemes for asphyxia. One simple practical one is suffocation, smothering, choking, strangulation, hanging, drowning, crush, or traumatic asphyxia. General post-mortem features of asphyxia. There are no specific autopsy findings for asphyxial death. General findings include external petechial hemorrhages. There are 2 small pinpoint collections of blood that vary in size from about 1/10 of a millimeter to about 2 millimeters. Larger than this, they are called ecchymosis. They are usually said to be caused by rupture of capillaries, but are actually thought to be due to rupture of small venules due to an acute rise in venous pressure. They occur most commonly in areas where the vessels are least supported, in this case the face, especially the eyelids, the conjunctiva, and sclera. It is often said that petechia are typical findings in asphyxial deaths, but this is not true. Their presence is highly variable, and they are common, non-specific autopsy findings. They are most commonly seen in asphyxial death related to compression of the neck or chest, leading to increased venous pressure in the head. And where it says see pictures, I'm not gonna show the pictures. Okay, you guys can pause the video, get the web page, and you can go to it. Okay, I don't want to upset anyone. I don't want to show anything too graphic tonight. I just wanted to give you guys some literature that could possibly help. Okay, and the next one says lividity, congestion, edema, cyanosis. Increased venous pressure leads to congestion and edema of tissues, especially the face, and marked lividity. Cyanosis of the skin may be profound due to the high content of deoxygenated blood. I am so sorry, y'all. I'm very tired after this. I'm got to go to sleep. Internal. The increase of venous pressure associated with asphyxia due to obstructed venous return and or impaired respiratory movements causes generalized organ congestion, plus or minus the edema. The blood is very dark or cyanosed. There is usually dilation and engorgement on the right side of the heart. The lungs are congested and edematous, and there may be petechiae in serous membranes, meninges, and thymus. Okay, remember the thymus, her thymus is gone. Okay, the classical features of asphyxia at autopsy may not be seen in some deaths, which appear to have occurred as an asphyxial setting because of vagal inhibition, vagal reflex, cardiac arrest. This may occur in any kind of asphyxial death, but notably occurs in strangulation, especially the manual type. Violent stimulation of the parasympathetic nervous system via the vagus nerve slows the heart rate and leads to abrupt cardiac arrest. Vagal inhibition may be caused by compression of the vagus in the neck, compression of the larynx, a blow to the abdomen, the shock of cold water on the skin in sudden immersion, putrefaction. It must be noted that asphyxial signs are very striking in fresh bodies only. They disappear progressively with the passage of time and as a result of putrefaction. Suffocation. True suffocation, also called environmental suffocation, occurs when there is insufficient oxygen in the local atmosphere, usually in cases where the victim is trapped in a small, unventilated space. For example, trapped in a cellar or mine, sealed in a trunk or safe, etc. Death usually occurs slowly, and there are no specific autopsy findings. As a rule, petechiae are absent. Smothering. Smothering and suffocation are often used interchangeably, but the term smothering is best used for that form of asphyxia in which the nose and mouth are obstructed, for example, by a hand, paper, clothes, pillow, plastic bag, etc. Gagging people to keep them quiet may lead to smothering. Signs of asphyxia are commonly absent or are only slight, and because marks of injury may be few, if any at all, homicidal smothering may be difficult to diagnose. Overlaying is the accidental death by smothering of young children by adults sleeping with them. In the UK, it is a criminal offense for an adult over 16 years who is drunk to have a child under 3 in bed with him or her because of the danger of overlaying. Choking. This is due to blockages of the internal air passages, usually by foreign material, for example, inhaled vomit, blood, food particles, especially fruit seeds in children, the tongue in comatose patients, etc. At autopsy, the features of asphyxia are usually well developed, and the offending foreign material is demonstrated in the airway. Okay, now this link right here shows a picture of a choking death due to pills, so I'm not showing that. Okay, the next one, strangulation. Death by strangulation is usually homicidal, but less commonly may be accidental or suicidal. Strangulation is due to constriction of the neck by a force other than the weight of the body. One may use a ligature, but the hands also may be used. Manual strangulation or throttling. The ligature mark is usually at a lower level and more horizontal than in hanging, and is usually located in the mid-larynx region, for example, at about the level of the thyroid cartilage. The mark is usually less prominent than in hanging, especially if a soft ligature is used. However, if a narrow wire is used, the mark may be deep and the skin may even be cut. Post-mortem findings. The face is markedly swollen and cyanosed with bulging eyes and a protruding tongue. And I'm pretty sure this is one of the reasons why this email got sent to me. Because the picture, well, on the footage, when they showed Kanika coming out, when they wheeled her out of the freezer, the picture, if you zoom into the footage, her eyes are completely bulged, okay? Petechial hemorrhages are often seen. The skin shows a constriction mark from the ligature or bruises from the fingers in cases of throttling. There is hemorrhage and bruising of the neck muscles. Fractures of the larynx may occur, especially in cases of manual strangulation, particularly of the supracornu of the thyroid cartilage and or the greater cornu of the hyoid bone. The lungs are edematous and congested. It is obvious that throttling can only be homicidal in nature. Attempted self-throttling would be self-defeating because the hands would loosen their grip when unconsciousness supervenes. Suicidal strangulation is possible but uncommon. It may be achieved by using a tourniquet mechanism or adhesive ligatures, for example, Velcro type bands. Accidental strangulation does occur, for example, from clothing such as a necktie or scarf becoming caught in moving machinery. Hanging. The neck is constricted by a ligature and the constriction force is provided by the victim's body weight. Hanging is usually suicidal, but less commonly may be accidental. Cases of homicidal hanging are unusual. Note that suspension of the body in fatal hanging does not have to be complete. One may die from hanging with only a part of the body being suspended. Hanging can occur in the sitting or slumped position where the suspension point is a doorknob or something at a similarly low level. Causes of death in hanging: suicidal, non-judicial. Number 1, asphyxia, due to compression of the larynx and or blocking of the air passages by the root of the tongue pressing against the pharynx. 2, cerebral hypoxia or anemia, due to carotid artery compression. 3, vagal inhibition. 4, a combination of any of the above. Post-mortem findings. These are similar to those seen in strangulation, except that fractures of the laryngeal cartilages are not as common. The ligature mark on the neck tends to be at a higher level than in strangulation and rises to a suspension point, inverted V shape, behind or under one ear or at the back of the head. As in strangulation, the ligature mark may be absent if the ligature material is soft, for example, a bed sheet, or where the deceased was cut down shortly after hanging him or herself, or where the body is decomposed. I will not be showing pictures of those hangings. Judicial. The sudden breaking of the body by the noose after a drop of several feet leads to fracture and or dislocation of the cervical spine, either at the atlanto-occipital joint, the atlanto-axial joint, or in the mid-cervical portion of the spine, with high spinal cord or brainstem injury leading to sudden death. The circumstances of each hanging must be carefully examined to determine whether death was suicidal, accidental, or homicidal. Autoerotic asphyxial deaths may involve elements of strangulation or hanging. They usually involve males and occur in isolated or secluded sites. There may be evidence of transvestite, I don't know how to say this, where they were transvestite, bondage, mirrors, cameras, etc. Drowning. This is defined as asphyxial death due to submersion in water or other fluid. Post-mortem findings. External. Signs of submersion, for example, sodden clothing, wrinkled waterlogged skin, especially of the hands and feet. Signs suggestive of drowning, for example, indications that the victim was alive when he or she entered the water. For example, objects from the water or shore, riverbank, clutched in the hand. For example, weeds, gravel, sand, etc. Persistent fine white froth at nostrils and mouth. Signs of asphyxia pedicae are not usually seen. Internal. Fine froth lines of trachea, bronchi, and distal air passages. Voluminous, sodden, heavy lungs may be indented by the ribs. Pressure from a finger will leave an indentation. Water in the stomach, seen in up to 70% of cases. Mechanism of drowning. Death is primarily due to hypoxia by exclusion of air from the lungs, but is largely due to electrolyte imbalance and or hemolysis from the effects of inhaled water on the blood. When water is inhaled into the lungs, the respiratory movements mix it with mucus and surfactant, producing the fine stable froth that is characteristically seen. Freshwater drowning. The hypotonic water enters the blood via the pulmonary capillary bed, leading to hypervolemia, hemodilution, hemolysis, and electrolyte imbalance, which serve to hasten death. Saltwater drowning. The hypertonic seawater extracts water from the blood in the pulmonary circulation, leading to hemoconcentration and electrolyte imbalance. The latter is not severe because there is neither hemolysis nor hypervolemia, and therefore death in saltwater drowning may be 4 to 5 times slower than in freshwater drowning. I am so sorry, y'all. These huge medical terms. Sorry, it's a little difficult. NB, a person may be said to have died from drowning up to 24 hours after being immersed in water. Having survived the actual immersion, it is possible to die later from any or a combination of the following: pulmonary alveolar damage, adult respiratory distress syndrome, ARDS, electrolyte imbalance, hypoxic brain injury, etc. Dry drowning. This refers to submersion in water leading to sudden death without the typical features of drowning being seen. The two causes postulated for this are: 1. Vagal inhibition, such as might occur in sudden submersion in cold water or falling unexpectedly into water. 2. Laryngospasm. Sometimes, even in expert swimmers, entry of water into the larynx may lead to a sudden severe laryngeal spasm and an asphyxial death, effectively due to choking. In such a case, one might see signs of asphyxia without typical features of drowning. Confirmatory test for drowning. Diatom identification analysis. I don't know if it's diatom or diatoms. Okay, it's probably diatom. It's microscopic. Okay. Diatoms are microscopic unicellular algae with heat and acid resistant shells of silica and are found in most bodies of fresh or seawater. An autopsy, specimens from liver, kidney, brain, and bone marrow can be digested with concentrated mineral acids. If diatoms are found, this provides strong evidence of drowning, as in order for these organisms to have reached the aforementioned organs, they would have had to be absorbed from the pulmonary vascular bed and carried to these organs by a dynamic systemic circulation. Note that the lung tissue itself is not used to test for diatoms because these might be present in cases of mere submersion of a previously deceased person due to passive influx of water into the lungs. A positive diatom test is especially valuable where putrefaction has rendered other methods of diagnosis useless. 2. Middle ear hemorrhages are characteristic, though not specific, of death by drowning. They are not to be related to barometric pressure. Biochemical test. For example, in freshwater drowning, blood from the left heart will be more dilute than that from the right, and the reverse will occur in saltwater drowning. These tests are relatively nonspecific. Crush asphyxia is traumatic. This is caused by compression of the thorax, abdomen, by a heavy weight, for example, a collapsed building, overturned vehicle, or stampeding spectators, for example, at a crowded stadium. Respiratory movements are prevented and blood is forced into the head and neck. This produces a characteristic deep engorgement and cyanosis with large petechiae in the head, neck, and upper body. Some cases are overlaying, may have a component of crushed asphyxia. Okay, so I don't really, I saw a couple things that could, help out with Kanika, or some things that may be relevant to that, or that could have something to do with it. But, if it doesn't help us with Kanika, maybe it can answer some questions for someone else's issues. So until the next video, I will talk to you guys later. I'm out of here. I'm going to bed. And today is the 24th, so Merry Christmas Eve. We're getting close. Have a good night, guys.